Hey everyone, welcome back to the channel. Today, we're talking about something that affects over 1.3 billion people worldwide, yet most don't even know they have it. I'm talking about hypertension, or as you probably know it, high blood pressure. Now, I know what you're thinking. Blood pressure? That sounds boring. But stick with me, because this condition is called the silent killer for a reason. And by the end of this video, you'll understand exactly why your doctor keeps checking those numbers on your arm. Let's dive in. What is blood pressure? Before we talk about high blood pressure, let's understand what blood pressure actually is. Imagine your heart as a pump and your blood vessels as a network of water pipes. Every time your heart beats, it pushes blood through these pipes, your arteries. Blood pressure is simply the force of that blood pushing against the walls of your arteries. When you get your blood pressure checked, you see two numbers. Let's say 120/80. The top number, 120, is called systolic pressure. That's the pressure when your heart squeezes and pushes blood out. The bottom number, 80, is called diastolic pressure. That's the pressure when your heart relaxes between beats. Think of it like a garden hose. The systolic pressure is when you squeeze the trigger fully. The diastolic is when you ease up a bit but water is still flowing. What is hypertension? So when is blood pressure considered high? Normal blood pressure is anything below 120/80. That's the healthy range where your heart and blood vessels are working smoothly without extra strain. But if your readings are consistently 130/80 or higher on multiple occasions, you have hypertension. Here's the breakdown. Normal, below 120/80. Elevated, 120 to 129 on the top number, with the bottom still below 80. Stage 1 hypertension, 130 to 139/80 to 89. Stage 2 hypertension, 140/90 or higher. Hypertensive crisis, over 180/120. This is a medical emergency. Now here's the scary part. Most people with high blood pressure feel completely fine. No headaches, no dizziness, nothing. That's why it's called the silent killer. Let me give you an example. Meet Raj, a 45-year-old office worker. He feels perfectly healthy, goes to work every day, plays with his kids on weekends. But during a routine checkup, his doctor finds his blood pressure is 145/95. Raj is shocked. He feels totally normal. But inside his body, that constant high pressure is slowly damaging his arteries, heart, and kidneys. It's like having a car engine running too hot. It might work fine today, but over time, it's wearing down. Two types of hypertension. Now, hypertension comes in two main types. The first is called primary or essential hypertension. This is the most common type, about 90% of all cases. With primary hypertension, there's no single cause. Instead, it's a combination of things. Your genes. If your parents had it, you're more likely to get it. Your lifestyle, too much salt, not enough exercise, being overweight. Age. Your risk increases as you get older. Stress. Chronic stress keeps your blood pressure elevated. Think of Priya, a 52-year-old woman. Her father had high blood pressure. She works a stressful job, eats out often, and hasn't exercised in years. Over time, her blood pressure crept up from normal to 138/88. This is classic primary hypertension. No single villain, just multiple factors adding up. The second type is secondary hypertension, only about 5 to 10% of cases. This happens when there's a specific medical problem causing the high blood pressure. Common causes include kidney disease, hormonal problems, sleep apnea, and certain medications. Meet Arjun, a 28-year-old athlete. Suddenly, his blood pressure shoots up to 160/100, which is really unusual for someone his age and fitness level. Tests reveal he has a narrowing in his kidney artery. Fix that problem and his blood pressure can return to normal. The key difference? Primary hypertension is managed long-term with lifestyle changes and medication. Secondary hypertension can often be cured by treating the underlying cause. Why does it matter? Okay, you might be thinking, so my blood pressure is a bit high. What's the big deal? Here's the big deal. High blood pressure doesn't just mean high numbers. Over months and years, that constant excess pressure damages your body. Your heart, it has to work harder, gets thicker and weaker, leading to heart attacks and heart failure. Your brain, damaged blood vessels can burst or get blocked, causing strokes. It also increases your risk of dementia. Your kidneys, the constant pressure damages the tiny filters, leading to kidney disease. Eventually, you might need dialysis. Your eyes, the delicate blood vessels in your retina can be damaged, affecting your vision. Let me paint you a picture. Remember Raj from earlier? If he ignores his 145/95 blood pressure for 10 years, his risk of stroke doubles. His risk of heart attack increases by 50%. He might develop kidney problems. He could face heart failure in his 60s. But here's the good news. Hypertension is one of the most preventable and treatable conditions. If caught early and managed properly, you can live a completely normal, healthy life. What can you do? So what should you do? First, get checked. Know your numbers. If you're over 18, you should check your blood pressure at least once a year. It's quick, painless, and could save your life. If your pressure is elevated or you have stage 1 hypertension, lifestyle changes are powerful. Reduce salt. Aim for less than 5 grams a day. That's about 1 teaspoon. Move your body. Just 30 minutes of walking most days can lower your pressure. Eat more fruits and vegetables. They're packed with potassium, which helps. Manage stress. Try meditation, yoga, or whatever helps you relax. Limit alcohol and quit smoking. Both raise your blood pressure. If lifestyle changes aren't enough, or if your blood pressure is stage 2, medication is important. Don't be afraid of it. These medicines have been proven safe and effective for decades. Back to Priya. After her diagnosis, she started walking 30 minutes daily, cut down on pickles and processed foods, and practiced deep breathing. In 3 months, her blood pressure dropped from 138/88 to 124/80. No medication needed. Here's the bottom line. Hypertension is serious, but it's not a death sentence. It's a wake-up call. Your blood pressure is one of the few vital signs you can actually control through your daily choices. So please get checked, know your numbers, and take action if needed. Your future self will thank you. If you found this video helpful, give it a thumbs up, subscribe for more health content, and drop a comment below. Do you know your blood pressure numbers? Thanks for watching, and I'll see you in the next video. Stay healthy.